Hello and welcome to Fast Medical Article Reviews. This is Mohammed. The article that we are going to be talking about today is called PDL1 and MRN synergy in platinum-based chemoresistance of head and neck squamous cell carcinoma. So basically, what this article is talking about that we have this head and neck squamous cell cancer over here, and we are going to destroy and kill these cancer cells using the chemotherapy cisplatin. But unfortunately, sometimes when we treat cancers, resistance emerges in those cancer cells. For example of this resistance is expression of PDL1 and NBS1, which can repair broken DNA in cancer cells, and thus it improves their survival. And this is called chemoresistance. So one way one thing we can do to prevent this from happening and to improve the efficiency of cisplatin is by using what is called chemosensitization therapy. So this therapy knocks down those chemoresistant factors, and so cancer cells become more vulnerable to cisplatin, and it's going to be easier to kill them later on. Here we're going to be knocking down PDL1 using chemosensitization therapy, and then we're going to see how survival factors, for example, such as epidermal growth factors, are going to be affected. So in this column, we're doing that on chemoresistant cells, which are cells that express a lot of PDL1 and NBS1 chemoresistant factors. And here we're talking about chemosensitive cells, which lack these kind of factors. So as you can see here, the expression of these survival factors have decreased after the administration of chemosensitization therapy. So as you can see, the expression of AKT has decreased, the expression of pAKT has decreased, and the expression of EGFR has decreased. So we see that in chemoresistant cells. But on the other hand, in chemosensitive cells, the only decrease in expression in survival factors was noticed in AKT only. We did not see the decrease in expression in the other type of cells of survival factors. I'm sorry. In this slide, we want to see how much does chemosensitization help cisplatin destroy cancer cells. So in this column, we're not using chemosensitization, and we see that cisplatin has successfully destroyed 20% of the cancer cells. But when we use chemosensitization, for example, when we target NBS1 chemoresistant factor, we see that the destruction has increased to 50% of cells. And when we target PDL1, the destruction was 65% of cells. And it's worth mentioning that when we use the two factors, when we combine the two factors for chemosensitization, the total net effect is destruction is of 80% of cancer cells, and this is called synergy. So synergy is when the combined effect is greater than the sum of their separate effects. So it's basically like 1 + 1 = 3. Thank you so much for watching, and I'm gonna leave a link for this article in the description. Thank you. Bye bye.